There's several things that we do before surgery, and these are all set up at the initial clinic visit when we schedule surgery, and there's several appointments that are set up. Number one, you need to have a preoperative physical. Typically that's done with primary care physician within a month of surgery. Number two, we have a preoperative teaching class that people will come to. Typically we invite their spouse or significant other, as two sets of eyes and ears always retain more than one. And basically it's a afternoon where you'll spend learning more about the process, what will happen before surgery, during the hospital stay, what to expect after surgery. You'll also meet with anesthesia that day, and they'll talk to you about your custom anesthetic plan. We have you meet with the social workers to talk about what your home needs will be after the hospital stay. Will there be needs for outpatient therapy, potential blood draws for monitoring blood thinner? Are there any equipment needs that you'll need in order to make things easier once you're home? You'll also meet with the pharmacist, and they will talk to you about your medications and what to take and what not to take. So it's a very comprehensive class, and it's things that we used to do while people were in the hospital after surgery. But after surgery, when you have pain and you're taking narcotic pain medications, it's very hard to retain any of this. So we found it's very helpful to do this ahead of time, where people can have their wits about them, ask good questions, have someone else there with them that can help them understand the process. Typically, you'll be here about 2 hours before surgery. You'll sign into the surgery center. The nurses will get your paperwork taken care of, get your IV started, go through a bunch of questions, things like that. Anesthesia will meet with you, and they'll talk to you about the final anesthetic plan. Usually they'll already have talked to patients about this at the preoperative class that we do, but they'll confirm that the day of and answer any questions they may have. The surgeon will come and meet with you and confirm the procedure and the proper side and sign the leg, and then you'll proceed to surgery. While in the hospital, a patient will have physical therapy twice a day. And oftentimes with hip replacement, we're able to get the patient up for their first therapy session the day of surgery. After surgery, it is important to have someone there, at least for the first couple of days. Most people find that very helpful until they become more independent with getting up and down from chairs and that type of thing. Rehab after surgery is critically important. I often tell people I can do the best surgery ever done on the face of the planet, and if the hip isn't properly rehabilitated, that might lead to a poor outcome. So I think that really highlights the importance of rehab afterwards. After hip replacement, typically we want you to use a walker for the first 2 weeks, whether you need it or not. After that, most patients will use a cane for 1 to 2 weeks. So by 3 to 4 weeks, most people are walking independently without any assistive device. Typically by 6 weeks, most people are back to most of their normal day-to-day type activities, able to drive a car, walking, able to prepare meals for themselves and do all their self-cares. And people will feel pretty good at 6 weeks. It takes about 3 months before people will be back to all of their normal activities, including unlimited walking, return to recreational sports, golf, those types of things.